Sharing the patient record can sometimes be a difficult thing, to be honest, particularly when it's working in secondary care and primary care and the interface between the two. And it'd be nice if there's an easier way of getting health information of the patient with the patient so they can share that with people that they want and make their whole healthcare journey a lot easier. Well, in this episode, we're joined by the team from AccuRx, so they're going to show us their new product, Record View, that hopefully solves that situation for the patients and also for you in practice. Let's take enhance your primary care and learning. Hi everybody, so we're joined by the team from AccuRx and stuff, and we're going to be talking about basically their new product, Record View. Before we get into it, I'm just going to introduce the team and let them know. So do you want to take it on, Sharon?
Hi there, I'm Sharon. I'm an operations manager here at AccuRx, and I sit in the Record View team.
Cool. Hi everyone, my name is Donny. I'm the PM for the Record View team.
Hi everyone, my name is Satya. I'm one of the clinical leads for AccuRx, background in pediatrics and supporting kind of AccuRx in secondary and community care.
Awesome. So through this stream, we're going to basically show you what Record View is, why it was created, and basically hopefully how it can help you in primary care and other places as well from what I'm hearing from the team. So I'm going to let them take over and basically go through the kind of their vision, I think is probably the best way of describing it.
Yeah, that's great. Satya, if you just pull up those screens, we'll just get right into it. I know you're all probably keen to see Record View in action. We've been working hard on it recently so that it looks nice and slick and beautiful for you. But before we jump into that, I just wanted to talk a little bit about AccuRx, which I'm sure you're all aware of, and just like what Record View means for our overall vision as we jump forwards.
Cool. So I'm going to bring it on right now. There we go.
Awesome. So yeah, everyone who's familiar with AccuRx should know that our end-all vision really is just to have everyone involved in a patient's care joined up and being able to communicate to anybody else involved in a patient's care. Up until this point, you probably know that we've focused really in on the patient and GP relationship, but you can see from this sort of diagram about that end goal that we want to get to that there's still a whole bunch more different aspects of like the overall life of a patient's healthcare that we need to zero in on, which is sort of why we've come up with Record View. If you hit that next slide, please, Satya. So we've already sort of demonstrated our integration with AccuRx in a primary sense. And what's up next for us is sort of growing that same adoption into the other fields of medicine. So our first step is definitely within like those acute trusts. But even more than that is diving into mental health care trusts, ambulance trusts, just the entire spectrum of healthcare in England. And one of the ways that we're going to do that is through Record View. So as we'll see in a little bit, Record View is really a way for anyone involved in a patient's healthcare outside of a GP practice to have immediate read-only access to that patient's medical record from the GP practice. It's similar to a shared care record or the LICRAs that are sort of being put in place all over the country, but with a couple main differences. Number one is that it's not a regional limitation in terms of who can see that record. Anyone in the country can request and view the record from anywhere else in England. It's a really cool approach in that we know that the GP practices are the ones who hold the rights to that data, but we're giving the patient the ability to provide explicit consent or permission for any other healthcare provider to view the record. Satya is going to get into the details about how all of that works, but really it's just I really wanted to zero in and hammer in on the fact that this shouldn't be seen as like a replacement to a shared care record or a shared care record system that you have already in place, but instead of a complement. When we think about AccuRx in the future and that place where there is a real communication record, so much information and so much of that rich information is held within that GP record. And so being able to include that and surface that across any healthcare providers is something that we're really excited to be able to provide like across the spectrum of healthcare. And I think that's enough of a little bit of a summary. So I'm going to hand off to Satya to talk about some benefits and then jump into the demo there. So yeah.
Thanks, Donny. And so we really started working on Record View about a year ago, and it was born out of this idea that when we were speaking to healthcare professionals about what the challenges they were facing in terms of being able to do their day-to-day tasks, One of the biggest things that we had consistently across primary, community and secondary care was a challenge in getting the information that you need about the patient at the point that you need it. And that's really where kind of Record View is born out of. We do see some immediate benefits to the GP practice. So if you're a GP who's working clinically and doesn't have access to EMIS or System 1, for example, if you're working in an urgent care centre, you would be able to quickly request the patient's record, see the summary of their record, and make clinical decisions off the back of that. We also know that there's some administrative kind of time saving as well by being able to enable Record View at the practice. So when we are speaking to non-clinical staff working at GP practices, everyone from practice managers to reception staff, asking them how much time they were spending in terms of actually sharing the record or information from the medical record or fielding incoming requests. We got responses anywhere from 2 hours a week to 10 hours a week, with 8 to 10 hours being the most common, which is not insignificant. So we do hope that this will free up non-clinical staff to do all the other hundreds of things that they have to do. But where we see the broader benefits are definitely across the NHS. So we fully imagine this to be used more by community, by secondary care. We've spent a lot of time kind of trying to understand our secondary care users in the same way that we understand how GP practices work. And what's clear is there's lots and lots of variation. However, some of the barriers to using existing record sharing solutions are similar, whether you're working in a trust in Manchester or in a mental health community service in Cornwall, for example. So really, that's kind of where we see Record View being used really widely. One of the examples that we've seen is from a consultant who works in an adult ADHD and mental health service, saying that they've got a shared care agreement with the GP practice, but they often delay that decision-making about what to prescribe for ADHD because they don't have access to the patient's up-to-date medical records, up-to-date investigations, etc. And all that happens is that those clinical decisions then get pushed further and further down the line until they get that information. And ultimately, it's about patient care. So what we fully expect this to do is to lead to safer clinical decision-making, but also make it a better experience for patients. For the majority of patients, they expect their information to be shared across the NHS. So if they've been referred to a service in secondary care, they fully expect secondary care to have all the information they need to kind of do their job. That often doesn't happen. That often isn't the case. And what we want to do is improve that patient experience. So the NHS, at least to a patient, feels far more joined up. There isn't kind of pocketed silos of information about a patient floating around. And actually anybody who's providing direct care for the patient has access to the information they need. And that's fundamentally kind of what we feel that Record View is about. As Donnie touched upon, it's also not bound by kind of regions or lycras and kind of restrictions, geographical restrictions in that sense. So if I was working in A&E in Manchester and I saw a patient from London who'd had an accident come to A&E, I could still use Record View to view a summary of the patient record. And it is a complete or an extended summary of the patient's medical record. So it includes things like medications, allergies, but also investigations going back to the last 2 years, GP consultation text if you're a GP viewing your own patient's records, immunisation status, so that it's a bit richer overview of kind of what's going on with the patient at any one time. And those are some of the broader benefits. I'm going to jump into the demo now so you can actually see what it looks like. And if I just change the tab, just stop sharing my screen for a second. Fab. So in order to request a patient's medical record, you would use AccuRx Web. AccuRx Web is our web-based platform that has similar functionalities for those of you familiar with AccuRx Desktop. But essentially, you go to AccuRx, fleming.accurx.com, or I think we're changing this now to web.accurx.com, and to log into AccuRx Web, if you have an nhs.net address, we integrate with the NHS Mail single sign-on, so you can use that to log in. Or if you have an nhs.uk address, you can register to use AccuRx Web as well. Once you log in, you're taken to this page. So you can, like I said, similarly to desktop, you can invite patients to a video consult, you can send them text messages, share digital documents, request a response back from the patient. Some of you may be familiar with AccuMail. From AccuRx Web, this allows you to message directly into the AccuRx inbox in AccuRx Desktop, and now we're going to talk about Record View. So the way that AccuRx Web works is that it integrates with the personal demographic service or the spine. So you must have the NHS number and the date of birth of the patient to search for a patient. We're going to use one of our test patients in EMIS here. And we don't support any soft or kind of fuzzy matches, so you must have those details to correctly identify and return the patient. You can see the patient demographic details are returned at the top here, just to make sure you've got the correct patient. And then, like I said, there's additional functionality, but to request the patient's medical record, you would click on Record View. That returns the patient's mobile number. Unlike other parts of AccuRx Web, you can't edit the patient's mobile number here, and that's really just to prevent anyone from entering their own mobile number to request a 2FA code. And the way that Record View works is that when you click on Send Text Message, it sends a message to the patient that says, this person at this organisation has requested to view your medical record. If you're happy to give permission, please share this 6-digit code back with them. So really the full expectation here is that you've had a conversation with a patient, you might be seeing them in outpatients, you know they're coming or they're in front of you at that time, and you let them know saying, hey, I've got this really cool way of being able to view a summary of your medical record. I'm going to send you a text message, you'll receive a code, and when you share that code back with me, then I'll be able to see the medical record. And it really is as quick as this. So you can see, again, you've got information about the patient at the top. We flag up if there are any known allergies so that you know to look and make sure that you've looked at the patient's allergies. And in terms of what's returned in the actual medical record, we have a full problem list broken down by significant and minor, and then you can expand past problems if you need to see those. We return medications and allergies, so you can see the allergies and sensitivities are returned really clearly up here. And we also return any comments about the nature of the allergy, where those have been recorded in the GP record. And then current medications broken down to acute and repeat medications with all the relevant information you need if you need to convert it to a inpatient drug chart, for example, including information about the dosing, when it was last issued, how many issues there have been, and then past medications going back to the last 6 months as well. As I mentioned, we return investigations going back to the last 2 years, and that includes things like blood test results with the reference ranges, so you can see what the blood test result was, when it was done, and also health status. So that's smoking, alcohol, and BMI, where that's been noted in the record. Again, it will return the most recent recording, and so whatever was coded in the record as their most recent BMI, that's what will return under health status. Immunisations that the patients had. And again, like as I said, if you're a GP viewing your own patient's records, we'll return the last 3 GP consultations as well. However, for most healthcare professionals, we won't return this. So if you're not a GP viewing your own patient's records, other healthcare professionals won't be able to see this tab. And then GP and patient details if you need to get in contact with them really quickly. And that is Record View. In terms of an audit trail, there's an audit trail within AccuRx Web, so you can see which records you've requested and how much time you have left to view the record. So after 24 hours, that view does expire. And if you wanted to view the record again beyond that, you would need to make a new request to the patient who would have to share their code again. So each request is met by patient permission. On the GP side, in terms of an audit trail to see who's requesting these records, when they've been requested and the status of those requests, you'll be able to see that from the Managed Practice page in desktop. So we'll show you the name of the person requesting, who's made the request, the email address, the organisation they've requested from, the time the request was made, and also the status of the request. So did it expire? Was patient authorization required and potentially not met because the 6-digit code was never given, etc. So we've put quite robust mechanisms in place to make sure that people can't use this efficiently, they can't use it to find out information about their partners, etc. The patient will receive a text message each time, and each time they'll have to give permission for their records to be shared. And then it is a time-limited restricted view for 24 hours, after which that disappears. And that is Record View in a nutshell.
Awesome.
Fab. So I think I'm just handing over back to Donnie here just to go through kind of what the next steps are for Record View, where we're at now. Donnie, if you want to take that away.
Cool, yeah. So we're super excited, and I'm sure a lot of you have maybe received 1 or 2 or maybe 3 emails from us. Right now we're at the stage where we're trying to get Record View up and running for our entire patient population in the UK. So since last Monday, I believe we sent our first couple of emails out there, and that's really what we need all of you to do, is to enable Record View for your practices. This allows us to then be able to send that message to the patient, giving them the ultimate decision as to whether or not they want to send their personal information on a case-to-case basis. But before that, we want to make sure that the practice is A-okay with the fact that we are going to be using the information. That's where we're at now. We're currently at 30% of all practices in England who are sort of eligible for Record View have enabled it, which is excellent. We're sort of blown away by how quickly that's happened, and we're just very keen to get to those next stages as well. From there, we're going to be kicking off with our first few real tests up in Black Country in the next couple of weeks, where we'll be pairing with a team at an adult ADHD clinic to just sort of see what Record View is like in the wild, if it were. And then from there, we'll be jumping into some more a regional approach, rolling out to specific trusts and so on in the coming months. So sometime around maybe November. As always, you'll hear from us when it is ready and live. And also when you as GPs can sort of use Record View to view your own records out of office hours, like Satya alluded to. And yeah, so really, if anything right now, before we jump into some questions and back and forth, we'd love if you could just go ahead and enable Record View. I think we've got a slide that has a QR code on it that you can use to scan to get into there, but we can also just remind you to look in your emails or your managed practice page to jump in and enable Record View at your earliest convenience. But yeah, I think that's all we wanted to talk about. We're very keen to sort of hear some of your questions and answers and jump into a conversation.
Cool, thank you for that. And really impressed with how slick the interface is with Record View in particular. You know, it's not busy, it's not chaotic, it's just nice, clear, clean, and simple, which is definitely helpful, particularly when you're going through a web browser interface and stuff. And I can, you know, also love the NHS sign-on process, making, you know, that security in terms of who could access it a little bit more secure and things. So awesome with that. I know I'm going to take this opportunity to ask for questions from our viewers and stuff, and I can see we've got quite a few, so hopefully we'll get plenty of stuff coming through. I'm going to take my liberties of asking a few questions that we've already had, just to kind of understand the process a little bit more, if that's okay. And in particular, so Donnie, you talked about people obviously switching on Record View through their practice systems and stuff. I guess one of the things that always comes to mind whenever we talk about data and all that kind of stuff is all the weird regulations and processes and all that kind of stuff and things. Can you just talk to how that's been looked at, what's been looked at and that kind of stuff, just to give everyone a reassurance as to kind of, you know, the integrity of Record View, basically?
Yeah, for sure. I'll briefly touch on it and then hand off to Shran to round out anything that I miss out on. But we've worked in partnership not only with NHSD, but also with the Caldecott Guardian to make sure that all of our IG and policies are sort of up to snuff. We've gotten a blanket approval for our approach in that, yeah, while we do acknowledge that the GP is the data controller, we're giving that ability for the patient to just sort of like borrow some information from my record from here on out. And it's been a really slick and smooth application process once people sort of understood what we were getting at. But I'll let Shran speak a little bit more detail to that if you have anything to add there.
Yep, just to add to what Donnie said, we've kind of engaged with NHSX, NHS Digital, the National Data Guardian on our approach, who have said that it's a sensible approach, and there's also some NHSX guidance that's been posted that that kind of alludes to our approach as well. And then beyond that, also we have all of the privacy and IG documentation in place. So our data processing agreement, privacy policy, and also a template DPIA that we provide. And then going beyond that, we also have the fact that GPs remain in control as they must enable Record View for their practice, as well as as Satya demonstrated, the secure method for the patient to provide permission for their record to be viewed. So it's kind of patient authenticated as well.
Okay, cool. So if people, practices in particular, needed to just update all their certificates, their privacy notes and stuff, that's all there. It's just going to the AccuRx ones and just updating it from the information that's published there. Is that correct then?
Yeah, exactly.
Cool. Okay. So,
and if anybody has any questions, feel free to reach out to our support team as well. We can help you through that process as well.
Awesome. So you mentioned obviously the use case of using it with clinics and that kind of stuff. I could definitely see one of the key ones being obviously when patients go to hospital in particular for either acute admissions or other kind of situations and stuff. Having said that, not everywhere will be pilot sites like the one you mentioned in the Black Country and stuff. So the people on the other side may not know about AccuRx Record View and how to use it and stuff. Is there anything that exists to help the patients or the practices explain how that's going to work from the user perspective for someone that may not have even heard of AccuRx, if that's possible, to be honest? But yeah.
Yeah, for sure. It's actually a really cool time for AccuRx, where aside from AccuBook, our vaccine booking software, this is going to be one of our first major touch points with the patient as something that we expect for patients to know about, to understand, and to sort of use as an advocacy tool for themselves. It's a bit premature now for us to start talking about how we're going to market Record View, because we still want to run through those final usability and checks with like our pilot organizations. But we will be running like a public campaign, not only with patients, but targeted towards secondary care users as well, across things not unlike this fantastic podcast, viewcast or webinar, but in the same sort of vein or channels in secondary circles, across hospitals, trusts. We're even looking into some bus campaigns, whatever we can do to spread the word around Record View. We will also include like some instructions and tutorials. Hopefully down the line, we can have an integration with like our GP partners who are referring their patients to be seen in consultation at trusts. Like, oh, you should tell your referring consultant that they can use Record View to view your own record, or maybe even in the future with our AccuMail product, sort of build in a Record View request therein, so that we sort of pick up on some organic growth as well. But yeah, making sure that patients and secondary care users, as well as our primary care users, all know about Record View is something that we're very excited to have a new product marketing manager join us and help lead the campaign, I guess you'd call it. Okay,
cool. I think one tip I might give, obviously we have the AccuRx SMS platforms and stuff, being able to have a template that kind of gives a quick instruction to the patient to say you're about to go to hospital, you may want to share your records with the person that you see. Here's a quick video to show them how to do it when you get there. So that might help to increase the uptake and stuff. I don't know if that's something to consider. And also, you guys have got some amazing templates already, but that would work across all the general practice, I would imagine, quickly and easily. So yeah, I guess next question I had was you showed us kind of the interface and how it's slightly different for GP consultations in particular. I guess going back to my example of using that with patients being sent to hospital, I may actually want the hospital doctor to see my last consultation. Will that happen? Because I wasn't quite clear. Because the way I took it was that it's the GPs only that would see the consultations, not the person that you sent the information to.
So currently, certainly in kind of the initial release, it will be if a GP is using AccuRx Web to view their own patient's medical record, they'll see the last consultations. If they are outside of a GP practice, they won't be able to see that. Now, the reason why we did that initially is when we spoke to GPs, there was some concern about potentially exposing third-party information, which is why we held off. However, that's definitely something we'll revisit. This is not kind of the final thing. We'll keep building on Record View, adding information as needed, etc. So definitely something I'm keen to explore. Would love to hear kind of what the thoughts are across a wider GP kind of user research pool. But certainly in the future, it may be that we end up exposing those if we find that there's a clear need in secondary care. It's something that we hear consistently on product feedback. We, as with all things, we always are responsive and iterative to actual users. So we would definitely consider adding that. I think also some of that concern is can be met by the fact that it's healthcare professional to healthcare professional. The patient cannot use this to view their own record. They are simply providing the code. So some of those concerns might be met by the fact that, you know, it won't be a patient viewing third-party information. It would only be another healthcare professional who's providing direct care to that patient.
Mm-hmm. And yeah, I think that's a really important point that you made, that it's not the patient that's seeing the record, it's going to the other healthcare professionals. And I guess that's particularly relevant, I guess, with the concerns like safeguarding information, that kind of stuff. So I guess just with that, is there a way to tailor what the other person sees when they access the records? Because I guess particularly third-party information, safeguarding information, those are some of the ones that obviously for the GP as data controller, they have a bit more responsibility with and making sure it's right and how that works and stuff. Is that control element there, or is it kind of all or nothing?
So currently there isn't. In terms of what's returned for the record, it will be those tabs that I showed you, which are, you know, the problem list, medications, allergies, immunizations, investigations, and kind of GP and patient details. With regards to safeguarding, the patients who have kind of safeguarding against their records in general, and for patients who are, those patients tend to typically be S-flagged on the personal demographic search, which means that there's some sensitive information that shouldn't be exposed to everybody, to other healthcare professionals. So those patients, when you actually try and search for them, you won't be able to return a search for them in PDS. And we build that in as kind of a safety mechanism, essentially, to make sure that patient details who are S-flagged on PDS aren't being made available to anybody else. And that's kind of our thinking around that. In terms of in the future, like I said, we're very keen to develop it, make it as useful as possible. And so who knows at this point, but currently at the moment where we are, it would be those tabs that are shared and that information from the record. And we felt that was most clinically valuable information in terms of what was needed across the NHS, but also people felt comfortable sharing those bits of information more than others.
Cool. So anybody who has just joined us as we're partway through this, so this is the Q&A section as we're going through the record view functionality by AccuRx and stuff. If you do have any questions, stick them in the chat. More than happy to ask them. I've got a couple more that just come through on my phone, which I'm happy to ask on behalf of other people. But, you know, if you want to ask them in the chat, let us know. And we can obviously share that with the team and get their views on the different things and stuff. Going back to data, if that's all right. So recently there's been a lot of stuff around GPDPR, which is the new version of GPDR and all that kind of stuff, and things like type 1 opt-outs and all that kind of stuff. Does that have any impact on this or not? Just for clarity for all of our practices out there.
So I can take that one, I think. I guess in terms of what we mean by type 1 opt-out, it means that patients declined for information to be shared outside their GP practice for purposes other than direct care. That's my understanding of it. Yep. Where we stand in terms of who can use AccuRx Web, so all users must meet our T's and C's, our terms and conditions, and our acceptable use policy that they must be providing direct care to a patient. So we already have that kind of safeguard in place. We don't expect this to be used by anybody who's not providing direct care, and they would actually, they shouldn't be using AccuRx Web if they're not. And I think ultimately the permission sits with the patient. So the idea is that you've had a conversation with the patient, they are well informed about this, and they can give the permission at that point. And so we've kind of caveated that with, because it sits with the patient, so if they don't want their information to be shared, they fundamentally don't share that 2-factor code, they don't share the 6-digit code. If they do, then they can share it and the record can be viewed. So it doesn't particularly, I guess, affect the way that record view can be used, in the sense that anybody who's using record view should have already agreed and confirmed that they're providing direct care to a patient.
Cool, thank you. Like I said, just wanted to clarify that for everybody, because it had a rather confused question saying all about this, and yeah, wanted to know. So if a practice was keen to switch it on record view and stuff, how long does the process take from when they've sent that email to you guys to them being able to see the benefits of what it does and how it does and all that kind of stuff?
I can take that. In terms of them actually switching on, sorry, I thought Johnny was going to say, I'll hand over to you, Johnny, if there's anything that I missed. So in terms of switching it on, you should be able to see it now from your managed practice page. We have kind of all the relevant information there, including things like how we've gone about information governance and why we're keeping data safe and secure, and what we're doing about that and how record view works. That is a simple button that you click to opt in. That essentially means that you've opted into making your records available, which means that if a patient then goes to secondary care, somebody could essentially request to view those patients' records, and they wouldn't hit this feature is unavailable for this patient in AccuRx Web when they try to search for them. What comes next in terms of seeing the immediate benefits? Where we are right now is we're going to release a small pilot initially just to get that usage, get that product kind of out, as we do with all our products, and then get lots and lots of feedback. So that's the stage that we're at right now. And then after that, once we're happy with the way the product's being rolled out, is kind of moving towards national release and making it available for everyone. I can't speak to timelines. I wonder if Donnie can speak a little bit more to that, or if there's anything else that you want to cover there, Donnie.
No, and that was the exact answer I was going to give. You just beat me to the mute button faster. But yeah, in terms of timelines, the only thing we could add is that we work iteratively, and so we'll be testing hopefully within the next 3 or 4 weeks in that initial pilot. Once we're happy with the results and we're confident that it's clinically secure and returning just the same information that it has been in testing, we'd start to roll that out more broadly, particularly with GP practices wanting to view their own records. I'm sure we'd have a waitlist in place so that you can sort of have early access or first access to testing it out once it is secure. Our goal, I'd say, would be by the end of the year, but it really just depends on how we roll out and making sure that there aren't any problems, because of course, making sure that the information is like secure, clinically relevant, and appropriate is our primary concern. Once those are done, we're just jumping at the bit to get this out to our users.
Just to round that off, our main ask at the moment is for GP practice to learn more about Record View and to opt in if you're happy to. So in the chat for the YouTube, I've also added in the link, and you can see it going across there for how you can opt in today.
Cool. And I guess the other question that we always ask for any kind of product when people show it us and stuff, there's always the inevitable question of cost. So does this cost the practices? And if not, how is it being worked out? Because it clearly has a cost at some point to somebody, and then, understanding how that works. I mean, is it part of AccuRx Lite, AccuRx Plus, that kind of information for practices that are keen to know? Yeah, let us know.
Yeah, this is an excellent question, and one that I'm super proud and happy to have an answer for. Just sort of similar to our AccuRx core features or AccuRx Lite features, we believe like this is just a tool that will dramatically improve healthcare in the UK. And so we're very happy and proud to offer it without a cost, neither to the requesting clinician or the offering clinician. So no cost. Obviously, it's part of our overall umbrella. We use the proceeds from our AccuRx Plus features and AccuRx Web Plus features to sort of fund the development of these things. But because it's just so intrinsic to healthcare, we're very happy to offer it as a free solution.
Cool. And you mentioned earlier
about did you have something to add to that? Sorry.
No, I think that was great. Yeah, it's going to be free. Use it. It's our first thing to try and link up all those different disparate services. So yeah, very keen for it to be used and for you to find value in using it every day.
Cool. One more thing to flesh out there, just around that free use. It's not. We're not trying to market Record View as a replacement to some of the other shared care records or like those that are already in place. And instead, we hope to use it as a supplement to those tools. So for all the work that's gone into making shared care records work in CCGs or ICSs around the country, we're not looking to replace them. We're just looking, as we mentioned before, like this is that first step in an integrated communication record across both primary and all the other areas of care.
Cool. So a couple more questions, if I may. So you mentioned about it being used on System 1 and EMIS. Are those the two clinical systems it can be used with, or will it be available with Vision and other ones that exist in the country?
So currently it is EMIS and System 1. Sorry, Donnie, go ahead.
No, I was going to say the same thing, and I just spoke a lot, so we'll hear from your lovely voice instead.
I was just going to say, so currently it is EMIS and System 1, and that's where kind of all the development effort has been. Obviously, we're very aware that there are other clinical systems in place in primary care. The challenge really is how we get that information out and how it's structured and that takes kind of significant development time, which is why we started with the EMIS in System 1. At the moment, we're going to pilot with those two systems to begin with. Again, as with everything, we'll see kind of where we get to. I'm not sure of the nuances with vision as I am with EMIS in System 1, so we can, we've kind of got that work in place already.
Cool. And I guess final question. So we heard about some of the system use cases that we talked about. So obviously the clinics in terms of ADHD and the pilot sites that you've got. I know from my perspective, having this available for patients when acutely attending hospitals potentially has a real benefit in terms of continuity of the records and the right information getting through. Are there any other kind of use cases that you've come across or heard about? And if not, I've got one, but I'll see if you guys have got anything else first.
I think at the moment, kind of, we definitely see the value is probably going to be exactly like you said, in the acute setting, in the outpatient setting, when you're potentially referred a patient and they need some context about the patient. Certainly where there are shared care agreements in place with GP practice and there is some element of information flowing back and forth. Those are kind of the ones that come to my mind to begin with. I think as we get it used, we'll find lots and lots more use cases, as we always do, with people using things innovatively and for reasons that we had never even imagined. I'm quite excited to hear those. But yeah, I'd love to hear whatever you've got kind of in mind as well.
So I guess for me, it's that kind of home visit situation where it may have a particularly an emergency application. So sometimes you may end up having to go out on a visit and you're seeing an extra patient, particularly, I guess, in care homes. And if you don't have the infrastructure already there to access the patient records, which some places I know don't have, then clearly having a bit more information at that point will be useful. I guess the other one as well is with PCN networks, with massive expansion we've got of workforce and other healthcare professionals now seeing our patients as part of the network resource. Again, IT, unfortunately, in some places is lagging behind. So there may be healthcare professionals that don't have, for example, a laptop to look at the patient's records whilst they're out visiting the patient. Correct me if I'm wrong, this should work on your mobile phone through a secure browser. So those clinicians can say to the patient, I just need to check something quickly, rather than me having to go back to the practice, figuring it out, calling you back later. Do you mind just doing this? Here's the code. If you're happy to give it me, I can check and we can sort this out for you now, potentially.
Yeah, absolutely. We definitely imagine it being used in that way. And even when you're at the care home or you've gone to see patient X and you end up being asked to see patient Y as well, you could use it in that vein. So definitely, initially, actually, the reason why we did build this was for that need, which was for GPs going on care home visits, going to emergency home visits. But obviously that shifted slightly in how that was being handled in COVID. And so but we fully imagine that, that's obviously still ongoing. There's still a need there. So you could absolutely use this on your phone when you're having to kind of leave the practice and visit a patient offsite.
Awesome. Cool. So definitely keen to see how this progresses and absolutely keen to see how the use cases develop as well over time. So more than happy to have you guys back on in a few months' time once you've kind of kicked it off and seeing how it's coming back and stuff to give us some of those cases, because I think that's going to really help people understand a lot better how things are working and things. I think if other people do want to check it out, obviously, we'll put the links down below. So you've already seen them in the chat, and I'll make sure it's on the descriptions for the videos and stuff so you can have a look at the things from there. Additionally, if you do want to check out any of the other AccuRx content and stuff that we've got loads of it about all the various different products and how to use them effectively for yourself and for patients. Check out the playlist on eGP Learning. That's on the YouTube channel or other places and stuff. Thank you all of you for joining us for this session. I know I've enjoyed it. I've enjoyed hearing about the product and particularly thinking about those applications for my patients moving forward, and especially hoping that we can have a better continuity of that information for when they're attending outpatients, admissions, and out of hours in particular, I guess, is the other big one, obviously, as you mentioned. If you do want to check out the information, I'm sure there'll be little things popping up on your screen right now to show you what to do. And as always, we're here to help tech enhance your primary care and learning. And we'll catch you in the next episode. See you later, guys.
Thanks so much for having us.
Thanks for having us.
Thank you.
Cheers. Bye.